And this month is Mental Health Awareness Month. So, our Coffee Connect, we are focusing on mental health literacy. This is our final Coffee Connect for the school year. We were just talking about the end of the school year and how quickly it came. And here we are in May talking about mental health literacy. So, thank you for joining us this morning. I am Sarah Gentry. I'm Region 5 Social Emotional Behavioral Learning Specialist. I cover ESUs 13, 15, and 16, and I will pass it on and let the rest of my team introduce themselves.
Hello, I'm Chandra Essex. I'm the Region 4 SEBL Specialist, so I work with ESUs 9, 10, 11, and 17.
And I'm Mackenzie Rydell. I am the Region 1 SEBL Specialist that covers ESU 4, 5, 6, and LPS. And then we have Jill Gunther, who is our Region 2 and our Region 3 SEBL Specialist.
All right, thank you guys. We're going to kick off this morning with a quick welcome inclusion activity. We always start these off in our presentations, so feel free to unmute. We just thought this meme might kind of describe what it feels like to be Wednesday with either the last week or the week before school is out. So realizing it's only Wednesday and you still have half the week to go, just go ahead and pop in the chat or unmute and say what is something that's going to help you get through this week. I am looking forward to just the great weather and after work being able to get outside and hang out. Danny says caffeine, and cheers to Coffee Connect and bring in our caffeine, right? Sunshine, amazing coworkers. April, I love that. We lean into our team so much in these busy seasons. You guys are wrapping it up and we're getting busy now. So, yeah, love that. Lots of great self-care. Only one more rush Monday morning before summer. Yes, we are on the home stretch. I love that. Love it. And hopefully nobody's actually really feeling quite as extreme as our little friend here in the in the meme today. But if you are, I hope that you lean into that sunshine, great coworkers, and caffeine and get back up on your feet. This is just a reminder, we have our Padlet link. All of the links that are going to be included in our presentation today are copied over into the Padlet so you can access those anytime. All of our past Coffee Connects are there, and then some general resources are always listed. The password to that Padlet is MTSS, all capital. Just another reminder that we have so many great resources for you guys to access along with our Coffee Connects. And then rooting ourselves into this morning, we wanted to just share this quote that kind of get rooted into the mindset of mental health and the importance of mental health literacy. I found this the other day and I just thought, my goodness, it fits so well just in what we do. I'm a mental health practitioner, so that's my background, social work and mental health. And I don't think I've ever seen a quote that just speaks it any more loudly of how important mental health literacy is. So what mental health needs is more sunlight, more candor, and more unashamed conversation. And I just think that this rings so true and really ties in so well with what we're talking about today with mental health literacy and how to promote that in our schools. We're going to quickly go ahead and define what we call social emotional behavioral learning here in Nebraska. It is that systemic process of building up those skills, fostering those skills for students and adults to create those environments that are positive and promote those positive mental health outcomes for everyone. We do this through the work that we do in establishing universal expectations, promoting mental health literacy, tying all of this in, the real why behind the work, and really tying it all in with our career readiness standards. And then we have our little reminder of our social emotional behavioral learning skills star that we've developed kind of in the corner and then expanded on in the next slide. So our next slide talks about our skills star. This is a Nebraska focused skills star, one that we developed. Took quite a bit of time and research and energy, and we've developed this as kind of a resource for the everyday teacher to look and say, what's going on in my classroom? How am I fostering that environment that promotes social emotional behavioral learning, promotes a positive environment for mental health? And then just kind of to guide them on different activities or ways of thinking about how to promote things like pro-social behavior. That question like is really how can I support others? To kind of break it down and simplify it into everyday language. And then those skills that we know that our teachers are already teaching every day in classrooms. These are things that we're already doing, but how can we pick up the ones that maybe we're not doing as well and build on those? So our SEBL Skill Star, just another great resource for teachers. I've actually seen it hanging in classrooms, and I think that's such a great um, testament to how helpful it can be to different teachers. And then getting into mental health literacy and the why. Why are we doing this? Why are we talking about this? We all know mental health has just been incredibly challenging, especially in the last 5 years. It's sometimes it feels like it's getting better, sometimes it really feels like it's not. So what is the importance with promoting mental health literacy in our school? Really making sure that everyone in our buildings understand how to maintain that positive mental health. So it's really tying that in with that social emotional learning. How can we teach the skills to our adults and promote those skills within our adults, model those skills with our students, and explicitly teach our students those skills and how to obtain that positive mental health. Understanding of mental health disorders and their treatments. Oftentimes we get students that come into our building that are struggling with something in their mental health. And just having that basic understanding of what that is. The understanding really, really promotes more empathy and compassion coming from the adults and the students. If there's some level of understanding that this is very similar to somebody that's struggling with a physical illness. So offering that grace, compassion, and empathy is so important once we have that understanding of what's going on with our people. Enhancing ability to get help when it's needed, and reducing the stigma. Those kind of go hand in hand together. Making sure that we are talking about this, we're teaching, we're learning about mental health and understanding, what's the latest research, what's happening, to kind of debunk those stigmas that exist and really enhance that ability to get help for our students or for our staff when they're needing it. Going into all of that, I don't know who all is. I feel like Smokey Bear is kind of like an 80s, 90s thing. So I hope there's a couple other people other than me and Chandra and Scott that might remember the real Smokey Bear campaign. But Smokey Bear kind of went in, I remember being in elementary school and Smokey Bear came to visit. And he had that awesome motto of only you can prevent wildfires, and he talked about being safe with fire and preventing wildfires. And it's kind of the same thing that we're talking about with mental health literacy. This is a prevention. This is how we start preventing those mental health crises, those big things that occur as a result of poor environments that foster those negative mental health outcomes. So mental health literacy is just one component of the prevention piece that we're looking at in helping build those environments for overall wellness for our kids. So we just wanted to make sure that we highlight mental health literacy as prevention. You can picture Smokey Bear. I kind of wish there was some big stuffed thing that went into schools to promote, mental health literacy. Like we need a mascot at this point. So if anybody's super creative and can think of whatever animal it would be, that would be awesome. Mackenzie says a brain stuffy. Yes, we need a big giant. Brains could be creepy though, so Smokey Bear was cute. He had that. He had an aura, as the kids would say. Um, our next slide talks kind of a little bit more about those different pieces in terms of prevention, things that we can do. So it's really broken down into the mental health risk factors at the top, and then those preventative factors at the bottom. Now, when we look at our mental health risk factors for kids, we look at difficult temperament, low self-esteem, negative thinking style, poor social communication skills. Uh, and then what I love on this chart is you go down and you look at those protective factors, and those are all things that we teach in social emotional learning. Those are all skills that are recognized on our skill star. Those are all things that we are doing every day and we're learning and we're improving on. So these are all things that we actually have some element of control in helping build up those protective factors. Now you slide over and you look at family, and that becomes a little more challenging. And I know that's a struggle when we're thinking about school and promoting mental health with our families. It's very difficult to change those dynamics that are happening when our students go home. However, what I'd like to always remind you guys and just kind of bring to the forefront, the protective factors that we're installing in our children, they're taking those home. And that's where we get those broken cycles. And then incorporating within the NeMTSS framework, we talk a lot about family engagement and communication. How can you promote mental health literacy and put that information out to families? Because oftentimes just having that basic understanding of how to take care of yourself, building on those social emotional skills, even for adults that aren't in our control, offering whatever you can to kind of promote mental health literacy within the family. In the school, we're talking a lot about school climate stuff, building up that sense of safety and security, building those positive relationships. I know at NeMTSS, we talk all the time about how relationships are really the center of social emotional learning, really kind of are the center of academic learning. So really, really focusing on building that sense of belonging, that connectedness, building those relationships as part of that foundation, and that, again, that protective factor for mental health. And then our community is kind of the same way. Again, one of those things that feels like it's a little out of our control. I'm from super small town of Brady, and I know that our school is the heartbeat of our community. So if our school is promoting something or building on something, it does have a rippling effect into what's happening in the community. So where it doesn't feel like we have a lot of control, we do have influence. So I just want to encourage you guys to kind of think outside the box. How can we promote mental health literacy outside of the four walls of the building? And then this is just kind of that reminder, mental health again is prevention. We're talking about mental health literacy. This is a tier 1 core support for our students. So we're building on knowledge. We're giving them the information and the tools that they need to promote positive mental health. And we know that that should mean that 80% of our students or more are demonstrating those positive mental health um, outcomes within the school district. If it's below that 80%, we're going to be thinking about intensifying. What do we need to do to promote more mental health literacy? How can we raise more awareness? How can we debunk that stigma? What access to care do we need to look at? How do we build on that foundational level? And then this is just kind of that reminder, and I talked about this a little bit about in the preventative um, on that chart earlier, but our tier 1 core supports for all students, they're fostering that positive, inclusive, and safe climate, so that building those relationships, enhancing that family and community engagement. Those are all components of those protective risk factors that we looked at earlier. And then just that whole child support. And we really want to be monitoring our data. We always want to make that reminder very clear, like we want to be monitoring what our school climate, what our overall mental health looks like for our students and our staff. So just leaning into that data. And I think I pass it to Mackenzie now.
Thank you, Sarah. Okay, so we're going to dive into each of those 4 components of mental health literacy a little deeper. And we first wanted to talk a little bit about why is mental health literacy important? And it's because mental health is a component of overall health. So the World Health Organization defines health as a state of complete physical, mental, and social well-being. And it's not just absence of disease. And so when we're thinking about health, oftentimes we only think of that physical component and we forget that mental health and social well-being is really a part of our overall state of health. And so as we continue to fulfill that full definition of health, we need to fill in those gaps and include mental health and social well-being in those conversations. And so when we think of health, we really think of that knowledge and understanding of both physical and mental health. And we know that there is a connection between mental health and physical health. And so sometimes we have chronic illnesses, physical conditions that lead to mental health problems like depression and anxiety. And sometimes our mental health conditions have physical manifestations like pain in your stomach or other things that impact you physically. So there's really that back and forth, and it's important to have both that physical health knowledge and mental health knowledge. And research shows that adolescents who have greater mental health literacy are more likely to exhibit that psychological resilience in times of stress. They're more likely to have some of those protective factors that Sarah was talking about that help buffer some of those risk factors. So this is especially true for our students who come from low socioeconomic groups. And it really suggests that mental health education in the schools is a great place to do that effective prevention effort. So that first component of mental health literacy is understanding how to obtain and maintain positive mental health. And mental health literacy really starts with recognizing the foundations for good mental health. So what is positive mental health? How do we obtain wellness? How do we obtain that healthy brain and embed habits that help create that wellness? So understanding and recognizing things like regular physical activity is good for not only your physical health, but your mental health. Healthy eating, getting adequate sleep, stress management techniques, all of those positive things that we're sometimes forgetting to do, but really just bringing them to the forefront and recognizing that we have to do some good, positive things to promote positive mental health, not just trying to prevent the bad from happening, but trying to increase the good from happening. So a great place to do this is in the classroom, especially when we're thinking of mental health literacy as that tier 1 practice. As if we put them in the classroom, it's going to impact all of our students and hopefully lead to more informed and more equipped people in our schools and also in our communities. So these are a few ideas of how you can bring mental health literacy into your classroom. So you can teach and incorporate those various feeling words to create emotional literacy. I don't know the exact number, but I'm pretty sure there's some research out there that like most people can name like 5 emotions, and it's usually like happy, sad, angry, mad, and they really struggle to go beyond that. And so being able to teach and model some of those words so people recognize how they're feeling, they're able to better identify their feelings and hit on that self-awareness, social emotional skill. Then we have those 3 inclusive practices to help build your classroom community and classroom belonging. That's another great prevention factor. So that is our welcoming activity to create some connection and community, your engaging practices during your academic instruction, and then also that optimistic closure and wrapping things up. And then modeling tools and strategies to use to create positive mental health. As the adults, we have such a large influence on our students. And if we're able to model some of those positive strategies, it really helps our students recognize and understand that. And then creating and encouraging students to use a space in your classroom, like a calm down corner, or just recognize that it's okay to ask for a break, or being able to advocate for what you need and take some of that time when you recognize that you might be starting to feel overwhelmed, being able to take that proactive step to really obtain more positive mental health. And then gaining and not only getting student voice, but amplifying student voice. So how do your students feel in their classroom? Hearing what they have to say, but then also letting them be part of that conversation to really get their voice and their ideas implemented into your environment. So what do your students think would help their mental health in school or in your classroom? Is there a different structure that you could maybe try to implement to help them practice or understand or learn from each other about mental health? Which goes right into the next one, is really discussing how mental health can be impacted using real life examples. We'll dive a little bit further into stigma, but oftentimes we don't talk about mental health. And a great way to start talking about it is talking about that positive side of health. So using some examples of those positive things that we've done that really do help us engage in wellness, and using real life examples is a lot more applicable and generalizable to our students. So if you are in a classroom environment, just take a moment to think about what are you currently doing in your educational setting to help boost mental health literacy. And we always like to have lots of activities, things that you can take and use right away. So this activity here, it's called What Kind of Happy Are You? And it comes from the Greater Good in Education and Positive Proof, which is another nonprofit organization. And it's a pre-created activity that you can use that helps students identify and understand positive emotions. They reflect on scenarios in their own life and then with each other and describe that experience. And then they are brainstorming ways they can feel positive in the future. And so, like I said, it's already pre-created. It has the worksheets, it has like directions and a planning guide, and it even has some extension opportunities with different links embedded if you wanted to further that activity on or dive a little bit deeper. So it's kind of a cute activity. And going back to that mental health, emotional literacy, naming different feelings. You can see on the slide here is an example of those 10 positive feelings. So instead of just happy, maybe you're feeling gratitude, or you're feeling joy, or you're feeling hopeful. And so naming, understanding, getting students to understand that there's different words to describe things and also feel what those might feel like. And then being able to name those can really boost some more of that positive mental health when we're thinking of that emotional literacy piece. So the second part of emotion or mental health literacy is reducing stigma. And stigma is those negative attitudes and beliefs that motivate the general public to fear, reject, avoid, or discriminate against people who have mental health problems or illnesses. So stigma results in people feeling shame and guilt over their experience and not talking about their experience. And it leads to misinformation over time, and it also damages and prevents people from getting help when they need it. So how do we reduce stigma? We can promote an accurate understanding of mental illness. So speaking the truth about what mental illness is and stopping the spread of misinformation or stigmatizing words or phrases. Speaking out and listening to yours or others' mental health experiences, being authentic in your mental health experience. I know, especially recently, there's a lot of conversation around mental health and being a mental health advocate and really speaking the truth and how empowering it can be to speak out your true experiences and really empower others to feel that they can speak about their true experience. Asking questions and learning more. It's so easy to just kind of slough over in conversations or comments about mental health, not wanting to ask or learn more about other situations. Educating others when you hear stigmatizing or negative beliefs. This one is hard to do. I actually experienced it the other day in a small group I'm in, and I didn't speak up, so I'm not a great example here. But I went home and my husband and I talked, and I was like, that didn't feel good. But also, like, I didn't know what to say in the moment because we're thinking about balancing relationships, but also having those hard conversations. Okay, and then empowering people to be proactive in their well-being and encouraging that early intervention. So by enhancing mental health literacy, we really empower people to take proactive steps towards their own mental well-being and promote that early intervention for mental health conditions. And this contributes to a more comprehensive understanding and more support in the society for dealing with mental health issues. There's also research shows that if a parent or a trusted adult holds negative views of people with mental health concerns, then the child is less likely to speak up about their mental health. And while this might seem obvious, I think it also gives hope for us in the schools to be that trusted adult who holds a positive view for mental health. Okay, so an activity here around stigma. This one is called Layers of Stigma. Stigma has many layers beyond just mental health. People face substance use and misuse, mental health problems, and also stigma because of identities around race, culture, and religion. So this creates barriers for people not only within their identities, but also being able to seek treatment and support for mental health when it's needed. So this activity can be done to help address and reflect on stigma. And so I'll just kind of go over what it looks like. This first you view the list of labels. I created a little image here with some labels. Obviously, they're a little stigmatizing because that's kind of the point of the activity. So reading them and reflecting on them, you'll see some of them are around some of those mental health stigmatizing things like psycho or schizophrenic or addict. And then there's other ones around different identities like single mom or homeless. So then they look at the labels and then they'll write 3 on a piece of paper. And then they'll identify negative stereotypes that is attributed through society with people in those labels and imagine what it'd be like to face or wear several of these labels at one time. So that is an activity. It actually comes from a little online course around stigma. So if you click on that link below, you can learn a little bit more. There's also a quiz on a parent and caregiver toolkit that is in our Padlet that I thought was really good. It's only like 4 or 5 questions about stigma, and then it goes through and if you answer the question in a certain way, it will kind of explain how that belief is stigmatizing or reinforcing some of those negative attributes to society. Okay, understanding mental health disorders and treatments. This is just having that basic knowledge of what mental health disorders are and being able to recognize signs and symptoms of various mental illnesses. So not necessarily making everyone a therapist. I think this is the part that kind of scares educators because they don't feel like they're equipped to be a mental health clinician, but the goal is not to create all these clinicians. It's just to create that literacy to where people are able to understand and have that basic knowledge so they are able to refer to those clinicians when support is needed. We added a couple of resources here from the Nebraska Department of Education School Mental Health team. So definitely go check those out. We also have a couple links from LB 852, which is about mental and behavioral health implementation in the state of Nebraska, and also those behavioral health training and resources. So if you haven't seen these, they'd be great to look at and also share with those in your district to maybe share out into your community. Oh, I did the thing where I clicked on the link. I knew I did it right after. Okay. And then just a couple more slides on mental health education. So as we're thinking about educating around those disorders and mental illnesses, we're giving that basic knowledge. And then we're also promoting skill development for students and also staff. So being able to embed those social emotional skills that Sarah talked about in our web earlier. So having students be able to self-reflect and analyze the influence of family, peers, culture, and media and technology on their mental health, being able to find valid information or good, positive, accurate information, using those advocacy and communication skills to get help. Fostering decision-making skills, setting personal goals, influencing and supporting others in a positive manner, and understanding healthy and unhealthy concepts of healthy and unhealthy choices that promote or hinder your positive mental health in general. Here's just a couple podcasts. The Mental Health Foundation, the National Alliance on Mental Health, and Mine on Mental Health. They're all linked, so if you click on them, it takes you to the website that has a list of podcast episodes. There's a ton of great ones around mental health. And I'm going to pass it to Chandra.
Thanks, Mackenzie. You know, we set up these Coffee Connects and we each have sections. And so it's hard when one of us start having coughing attacks and we want to jump in, but we also don't know if you want us to jump in. So you get to see real life how we do these things. So Mackenzie did a great job in setting up 3 of the 4 areas. So she talked about that, understand how to obtain and maintain the positive mental health, understanding mental health disorders and their treatments, reducing stigma. And so the last one that we want to talk about is the enhancing the ability to get help when needed. So this really involves the ability to, seek support and having that knowledge of those different types of treatments that are available. So is that medication, psychotherapy, lifestyle changes? Where do you go to seek that help? And then how do you take action to get that necessary support? And it just really kind of depends upon the nature of the symptoms or the disorder, what that right course of action might be. And so it's really knowing what the supports are in your building, in your district, and in your communities. Is that your school counselor, a therapist, or a mental health practitioner? Your primary care physician, social workers, psychiatrists, community mental health services. Those are all some places that you can go to get that support. But the really big piece we want to make sure that we hit on and emphasize is that it's okay to ask for help. When we think about that negative stereotype and how we're reducing that stigma, part of that comes from understanding it is okay to ask for help. And sometimes with mental health, we can't see the physical manifestations that happen in our bodies because it is happening internally. And so being that advocate, being that person to say, I just need help. And that can happen in a variety of different ways. So we always want to think through in our buildings and in our schools, how are we helping our students and our staff know who are those people to go to? So when we think about that, we want to think about who are school mental health providers. On this slide, it talks a little bit about each one and where their expertise comes from. So is it a degree? What's the requirements? But then what are all those national organizations that help enhance those positions in your building? So is that a school counselor? Those are master's degree individuals. So they've had extra schooling to have that expertise and that support and that understanding of what that means. Your school nurse, again, talking about that physical and mental health. They can help with both of those and they can share those resources and that they have associate's degree. There's 3 years of professional diploma, bachelor's degree level and higher. So there's a variety of different educational requirements for school nurses and for nurse practitioners and those above and beyond. Your school social workers, they have a master's degree. There's a Nebraska Department of Health and Human Services certificate. They are licensed mental health professionals. They have the clinical understanding, they have the family structure understanding. And so that social worker is a very powerful position to have in schools. And we wish we had more of those in schools across our state and just be able to help see that system in addition to the individual. School psychologists, those are specialists. They have a graduate level or maybe a doctorate degree. They are able to do testing to see what are some of those concerns that a student may have and to help with that identification of what additional resources those have. And then your licensed mental health practitioners. So those are master's or doctorate level. They have a DHHS license, but they're licensed mental health practitioners. They have the ability to diagnose and they have the ability to help do treatments in a more intensive way than a school counselor. So all of these positions are great to have, and maybe you don't have them specifically in your building, but to at least have the resource in your community of where you can help your staff and your students get connected to and families get connected to is where that important knowledge happens of knowing where to get help. The teacher's role in school mental health is so key. Mackenzie talked about it and Sarah talked about it. Mental health literacy is that tier one strategy. And tier one strategies help address those mild problems. They start from the beginning. So the teacher is the one that is the temperature in the room. They help students understand when it's okay, how to respond appropriately. And so their roles can help maintain that healthy classroom environment. They can have strategies that are simple to implement, that just require minimal resources and really benefit all of those students in the classroom. Teachers are trained to educate students, and their expertise to work with those children. The very difficulties can vary greatly. And so teachers do not and should not diagnose children with mental health illnesses. That's not their role, but their role is to build that relationship and to have that opportunity for students to come and talk to them. Again, remember we talked about it's okay to ask for help, and the student has a relationship with a student, and that's or with a staff member, and that's where it can start. Teachers have a large role in maintaining that healthy classroom environment, like I talked about. Um, and they have the ability to refer to others when necessary after they've helped identify that difficulty. A teacher may not know and does not need to know what all of the mental health diagnoses that are out there, but they can speak to the behavior and the temperament and the physical manifestations maybe that are happening in the classroom that they see every day, and they can help advocate on behalf of that student to those in the building that need and can't get them additional support. So when we think about that school mental health provider role, what we did is we broke that down according to our essential elements, our four essential elements. So when we think about what are those systems that we have in our buildings, what are those teaming structures, and I won't read all of these, just highlight a few. But what is the representation on your MTSS team or on your continuous improvement team? Where does the mental health role reside on those teams? Can they suggest or facilitate potential mental health professional learning opportunities for that MTSS team and for administrators? Where is that happening? Can they advocate and make public statements to support for mental health efforts that are happening in your district? Then we think about how are we communicating this out? What does this look like? Is there opportunities to collaborate and strengthen relationships with stakeholders? Those mental health providers, they're on the team. Are they able to communicate that? They're the ones that can help elevate that student and that family voice around the topics of mental health and mental health literacy. They can help maintain that visible presence on your campus. And so there's a variety of different ways that that school mental health provider can help communicate to all stakeholders on what mental health looks like. Then we think about those layered continuums of support. So again, we've said multiple times that mental health literacy is that tier one core support for all students. And I would also push to think it's for all staff. And so it's everyone in the building that is pushing to help understand what is that mental health literacy and how do we look at these four areas. How do we provide then those targeted or those intensified supports that need to happen? Is that small group counseling or small group SEBL topical groups? So short-term individual counseling, do we need to get them into? How do you identify the evidence-based tier two targeted supports and tier three intensified supports? What does that look like? And then refer to school and community services as appropriate. We always want to make sure that we're connecting our students and our staff to those resources. That is a piece of that layered support system that you have in your buildings. And then, of course, we want to think about data. We want to collaborate to identify those relevant student and adult mental health data sources, where what's telling us what our school tier one supports need to be targeting? Is that through a universal screener? Is that through a behavioral matrix screener? So you're able to see where are the data points that show you what the concerns are. Being involved in the student and adult mental health data collection and that analysis, that school mental health provider should be in that lead role or in a very high supporting role of gathering that data and help analyzing that data. And then ensure that those mental health supports are aligned with the school and the district continuous improvement efforts and the evidence in those goals. We want to think that what we're doing for school mental health is just aligning and it helps support what you're doing in your continuous improvement plan. Because once we can help our students and our staff understand how to regulate their brains, how to get them in the most optimal place for learning, then we'll see that just successes not only in social emotional behaviors, but also in the academic classroom. So when we think about mental health, it is not a continuum, which is hard because we want to think that, hey, we love continuums in education. We just love them. And we want to put this on a continuum of mental illness to mental health problems to distress, but that's not how this works. When we think about mental health, it's the impact of mental health has on our daily functioning. And the closer you were to the far right or the end of that continuum may have been where you thought you would be. However, the Mental Health Literacy Collaborative challenges this thinking and argues that mental health is not that continuum. So if we think about an example might be, what does distress look like during finals week for college? For that student, maybe they're stressed out about studying and performing well on their finals. Thinking about, are you stressed out because it's the end of the school year and the testing season and a testing season? That's appropriate. And that's an approach that happens. But that doesn't mean because they are stressed for that season that they have a mental illness. So distress doesn't always connect to a mental illness. It can just be an environmental component of what's going on. A mental health problem may look like, your mom was just diagnosed with a terminal illness and you are grieving and coping with this news. Mental illness may look like more you're diagnosed with that depression versus having the depression and being down because your mom was diagnosed. So there is a difference. And like I said, just because you maybe have a distress does not mean that you have a mental illness. It means that it could be the impact of your environment versus a mental illness can manifest itself in distress. So it's not a continuum. These are different components depending upon what is happening. And just remembering that mental health is inclusive of all mental wellness.
I'll just jump in here too, Chandra.
Thank you.
Thinking about like historically, we've thought a lot about mental health being on a continuum, but when we're viewing it on a continuum, you see mental illness, and that is like, if you have a mental illness, then you're like, that's your whole identity when it comes to mental health. But you can have mental illness, a mental health problem, and distress all at the same time. And you can also be diagnosed with a mental illness and be thriving. And so with a continuum, it kind of had that feeling that if you have a mental illness, you're stuck there and that's your identity, and you're somebody who has depression or somebody who has bipolar disorder. But when we're thinking of the whole person, whole child, whatever you want to say, that you can have a diagnosable disorder and also be a great person and have joys in life and have a issue come up when you lost your job and that's really hard to deal with, and that isn't encompassing of that. So it kind of just opens it up a little bit to encompass the whole person and recognize that even though you have a mental health illness, it's not something that necessarily has to be your whole identity. You can have so much more in life and joys and positive mental health also.
Thank you, Mackenzie. I think that was a great addition, because when we think about mental health literacy, one of the big pieces that hopefully you're hearing and you're picking up from this is getting literate. There's a quote on the screen that says, with good mental health literacy, we learn how to better care of ourselves, our loved ones, and our communities. We are empowered and provided with the skills we need to help us build better lives and better systems of care in a better society. And I want to really hit on Mackenzie's statement of we can be diagnosed with a mental health illness and still be thriving, and that is not our identity. So as we're working with our students, they're not a student that has ADHD, or they're not ADHD then that's how you identify that student. They're a student that has ADHD, but that's not their identity. They are a thriving, they love math in your classroom. They have great friendships and great relationships. They have the ability to be able to handle some of that anxiety or some of that type of impulsivity at times. So it's a component of them, it's not their identity. So on the screen, in these bubbles, we just wanted to kind of point out to help debunk that myth of, depression is not the same as having a bad day. Depression is that common and serious medical illness that can negatively affect how you feel, think, and act and perceive the world. It is a mood disorder characterized by persistent sadness and that loss of interest or that pleasure in activities. And that's what depression can be. And that's what depression is. When we think about OCD, OCD is not the same as being organized. Obsessive compulsive disorder is that mental health condition. It's characterized by unwanted intrusive thoughts, those obsessions, and it's the repetitive behaviors of those mental acts, those compulsions performed to try to manage those thoughts. These obsessions and those compulsions cause the significant distress and interfere with that daily life. And I'm not going to read them all. I just want to highlight a few of them. ADHD, the attention hyperactivity disorder, is not the same as being hyperactive. So that one, it is the most common mental disorder affecting children. Symptoms of ADHD can include inattention, so not being able to keep focus in the classroom, outside the classroom, just not being able to keep that focus. That hyperactivity, so excessive movement that is not fitting to that setting, and that impulsivity, so hasty acts that occur in the moment without that thought that's happening. That's what ADHD is. And then, anxiety disorders, we may be seeing more of those in the classrooms. So what is anxiety? Anxiety disorder is not the same as feeling stressed before an exam. What anxiety disorders are is they're a group of mental health conditions characterized by that excessive fear and the worry that interferes with their daily life. They are more than just occasional nervousness. They involve persistent, excessive worry and anxiety that can be difficult to control and cause of significant distresses. So we wanted to show you what it is not and what it is in some of those. And so it's just thinking about how do you get literate and how do you understand. You don't have to be the expert. It's just knowing enough to help to get those resources to the students. So when we think about school-based mental health and SEBL alignment, those two go so well together. SEL and mental health are not the same, but they can promote that positive mental health in many ways. By promoting that responsive relationship, the emotional safe environment, skill development, SEL cultivates that important protective factor to buffer against the mental health illness. So when we think about what does this look like, what does this mean, it's those opportunities for that mindset and those skills to be developed to enhance the resilience, the emotional regulation, the relationships, and those positive coping strategies. And those can be essential for mental health and that mental well-being. So this can include those school family connection partnerships, the professional development that happens for our school staff, supporting school staff well-being, trauma-informed care infused throughout curriculum, throughout instruction, and sharing those priority incomes of that caring, inclusive, and equitable schools. You'll see here on the screen a great graphic that shows that research confirms that SEL can support key protective factors like stronger relationships that help reduce risky behaviors and mental health. The Nebraska MTSS team has been working this last year becoming trainers for restorative practices. And we have trained a number of educators, and where we start in restorative practices is in relationships. We talk a lot about when I know your story and you know my story, it's less likely to harm each other. And that comes from building those relationships. And relationships can be built through social emotional learning that happens in the classroom that then can have an impact on mental health. So we just want to remember in building those relationships is key. The well-being with our SEBL skills. So Sarah mentioned our SEBL skills earlier, and we have broken those down into well-being within those skills. I won't go through all those because we are running short on time, but this is a great resource that you can see and you can pull out and kind of identify those. So here are a few resources. We always want to make sure that we try to give you some options. So there is from the mentalhealthinstruction.org. They work with U of A Smart Center to vet kind of that mental health literacy curriculums and post them and those resources on their website. So we've pulled out a few of those. Here is a resource for elementary school for mental health and high school curriculum guide. And then below is one on pre-K. So those preschool students, those early education, early childhood literacy, those types of components. I don't know why I said literacy, early childhood. We also wanted to talk about too the staff. So Classroom Wise is a great resource that had been created. And it is an free online course that staff can walk through of how they can become more aware of well-being information and those strategies that can help them in the classroom. And then again, this mental health instruction, providing teachers the best path for mental health curriculum programs. So just a lot of great resources. All of those can be found on the Padlets. So we want to make sure that you have those resources. So this wraps up our Coffee Connect for today. Please click on the exit ticket, and Mackenzie's going to put that in the chat because we would love to have your feedback about how these topics are, how the Coffee Connect's delivery is, and giving you information. And so we love to have that information back coming from you. So our next Coffee Connect will happen in July. Obviously, like we said, this is May. This is the last of the academic year. So as our time kind of gets crazy in June with professional development opportunities, we take a pause for Coffee Connect and we come back in July. So educator wellness will be our topic. So join us then. And then just a few reminders, here are our summer events. You can click on that graphic and register for those. We have our Tier 1, Tier 2 supports, trainings, and then it has our summer Coffee Connect information. We are also hiring for the Integrated Support Specialist position. We have 2 open positions right now, and as our organization is changing, its format a little bit this next year and how we're delivering resources to our regions. This comes through an integrated support specialist. So we are looking for one in Region 3, and that one goes through ESU 1. So if you're interested in that position, please click on that link and it'll take you to ESU 1's posting. And we're looking for one person in Region 4 or 5. So again, and that one, that grant goes through the University of Nebraska-Lincoln. So you can click on that resource. So we are hiring. We want to have great people come to work with our team. So
And just, I'm gonna pipe in there, be aware the closing date for this position is today. So if it's something that you or someone else is interested in, we're really serious when we say apply now, or at least reach out to the team to see if you can maybe potentially get an extension if it's something that is interesting to anyone.
Yes. So of course our summit's coming up, and this year our theme is literacy. So we're taking a road trip. Who doesn't love a good road trip? Road trip to Kearney and navigate literacy on the MTSS Highway, October 9th and 10th. Join us there. We would love to see you. And our optimistic closure. So thinking about snapshot gratitude, if you could take a picture of one moment from this week that made you happy, what would it be? Reflect and write about that snapshot. So what would your snapshot of gratitude be? So maybe take 30 seconds, think about that and write it down. And keep that present in front of you for today and for the remainder of your time while you're in your school, remembering that it goes fast, but we always have the ability to think about how we can be gracious to ourselves, and that's where it starts. Heather, I love that. Sitting on the swing in the backyard with my husband and dogs, watching hummingbirds at the feeder. That's awesome. I love it. My snapshot of gratitude from this week would be my daughter. It's just been fun to hang out and have a little bit more extra time with her this week. So thank you for joining us. And again, we're the NeMTSS SCBL team. Here is our information if you want to reach out. We'd love to hear from you.